So I'm going to be talking today about dementia resources for our patients and families. And when we talked about this as a presentation topic, we recognize this is really a basic talk, and I think it'll be a review for a lot of people. I've tried to include some updates since the similar talk that I did about 2 years ago there. And then also from the feedback that people had provided too, also links up to information about resources, especially for folks that are non-English speaking folks. And to be honest with you, this is a huge topic. And it's been just very unwieldy for me to try to think about getting this down to about 20 minutes for this topic. So I'm going to apologize in advance for any resources that weren't mentioned today. And I'm thinking that if you have one that you also want to share, maybe put it in the chat for us or save it for the end so that we can talk about it together. I did include, I've also created a handbook, a handout for people with actual links to the resources that I'm talking about today, so that you're able to go a little bit deeper into those too. So let's start. So as I was thinking about things to present about and how to kind of get this down into more manageable time frame, I was thinking about sort of those principles of a dignified diagnosis and how that is sort of like a grounding for the type of, for the resources that we should be thinking about for our patients, both at diagnosis and throughout the course of their condition. That idea of, talking to me, the person directly, providing plain and accurate information, tools for living well with the disease, and a plan for continuing to have a quality of life. So I've been sort of thinking about that as I was thinking about these resources that we'll share today. So these dementia resources are available. Basically, all of the major dementia organizations created some great, really basic resources available for family members. They're all easily available for folks that have access to the internet. They're all available to download. You might want to consider as an organization to have some copies of the Lewy body dementia booklet, which is provided for free by their website. To just go to their website, sign up for it, and they'll mail you out. They don't limit the number of books that you've gotten. I've gotten quite a bunch from them, and they've never told me that it's too many. So I did put a link in the handout to that. Same thing with the Association for FTD. The Doctor Thinks It's FTD booklet is also available for them to send out 5 free copies. Again, these books are ones that have tried to sort of incorporate both information for patients themselves, their family members, and to some extent some providers as well. A number of their websites from these organizations have started to kind of incorporate the voice of the person with dementia a little bit more. Going to the Alzheimer's Association, I really like how they kind of created a whole page just for me. I have Alzheimer's, these things to do to plan for your future, how to live well, tips for relaxation, where to find support, where to find those early stage memory loss programs. There's a number of those in Washington. They've got some great programs happening over in the Tri-Cities area. So sort of going through this portal is a great way to find that. Again, if your folks are able to navigate the computer. I also wanted to point out, I put a big red arrow at the top right where you can see in Espanol, where if you hit that tab, it actually switches the website over into Spanish language, and then it kind of shows up as the reverse to English too, so you can go back and forth. So really, they have so many materials on there that are available in Spanish, which is great. They also have an Asian languages section that includes both I have Alzheimer's section and I'm caring for somebody with an Alzheimer's. And on that one, they have translated their materials into Korean, Chinese, Japanese, and Vietnamese. And I put a link to how to find that resource on the handout that I compiled for today. I'm still on the lookout for another basic handout for people with memory loss that's easy to give out in clinics. The Living with Memory Loss, a basic guide, is one that we use through the Memory and Brain Wellness Center. It's available for patients to read for free. The challenge is it's 135 pages. And so I know realistically, that's a hard one to print out for anybody. And I know so many people aren't able to read. I would love to hear from folks in the group what they're using for that sort of, at the moment of diagnosis, something that is actually patient based. So if you have any great resources, please put it in the chat or save it for the end to share with everybody. So thinking about sort of living well with memory loss and sort of having quality of life. Thinking about some of the main resources, one of which is the local area agencies on aging, community living connections. They go by different names in each area. And that's really the go-to place for both practical issues, education, and support. So if you're thinking, does my patient qualify for chore services or having a caregiver in? It looks like they, are expressing concerns about the cost of long-term care. Might they qualify for DSHS programs? For those people who we are letting them know that they're no longer safe to drive or need to start thinking about retirement from driving, what are the local transportation resources? Some of our communities do have some pretty good transportation programs, and not just in the urban areas, where volunteers are sometimes utilized in order to help people get out and about, especially to other appointments. I'll talk more about sort of that important caregiver support network programs that are offered through there. Also in terms of like navigators or guides, the Alzheimer's Association has that really great 24-hour helpline that's staffed by 24-hour social workers. And so that is sort of, if you don't have a social worker in your clinic or somebody to help with like resources and coordination, you can call them, your family can call them, or the patients can call them themselves to be like, this is where I'm at, or, my loved one is having these behaviors, it's stressful, how can I help this situation? The Alzheimer's Association let me know that they have recently decided to move away from providing brochures. Instead, they are making kind of a publication list where you can download from them and print out those materials in the clinic. So I did include the list of the link to that resource in the handout that I'm going to give out. For folks that live in Whatcom and Skagit counties, the Dementia Support Northwest is sort of the go-to agency for getting connected with early stage memory loss programs and social events. A lot of their things, I believe, are still happening virtually. They also work closely with the Northwest Regional Council up there. We talked about this the last time. If you're not sure who your area of agency is, or if you wanted to refer a patient to them, they, about a year and a half ago, created this sort of refer a patient from their website. So you can actually go to their website, hit the refer a patient, and then you'll see a list of like, what things should we talk to them about? Caregiving resources, wellness classes, transportation. That's a list that you are offered if you go to that section. Legal resources. So there's been some new resources since we last spoke about resources. I so appreciated Dr. Gaster's presentation on advanced care planning 3 weeks ago. And one of the things that we talked about is that importance of really determining a health surrogate. And a alternate early in the process. These are some resources that can help make that easier. There's the Dementia Legal Planning Toolkit, which is available online. Also, if you wanted to get a hard copy, Allison has some that she could send out to you. And that kind of walks through sort of thinking about a power of attorney and other planning things too, and also has actual copies of power of attorney forms on it. If you're downloading from the website, they link to some of the resources through Washington Law Help. And I was really excited to notice that they actually have some of those power of attorney forms translated into a number of languages. And they're sort of written to have, they're kind of bilingual forms. I'm constantly on the lookout for any resources for our Somali folks or Tigrayan speaking folks, Russian speaking folks, which isn't as available as some of the other resources. So I was excited to see that they have that on there. Another brand new resource that is just getting started this year is the Dementia Legal Planning Program, which is a statewide program where there are actually attorneys to help folks, to meet with folks and actually walk them through those forms. They do have attorneys that are participating in this program throughout the state. For people, they also offer their services through Zoom, so that I think in the age of Zoom that makes sense anyways. But you can also meet in person. I know that they have some in Tri-Cities, all through the Puget Sound area, Spokane area. They also utilize interpreters. So if you have a family who really needs to have more in-depth discussion about sort of the legalities of that and to get those forms, they will use either a Zoom interpreter or a telephonic interpreter to help with that process. And it is important to know that they don't actually do the notary, so they'll kind of get things set up and then give it to the patients and direct them towards like a bank to get those to get that services notarized. I'm excited to see if that is a helpful resource. I know I'm excited about it. All right, so moving on to more specific care partner resources. This is really the classic one. I think that I feel very proud of our state to having something like this. I will say that it's very care partner focused. And so if you just gave a new person a diagnosis and don't have other kind of basic materials to give them, it's not a good one to give to just a patient unless their focus is on, I'm really focused on getting things to my family, because it really is geared towards the care partners rather than the patients themselves. As you can see, it's available in English and Spanish. I think this is a really great material to be read in person, to be read in the paper copy rather than online. Currently, if you can order them, if you order a quantity of 25, they're 60 cents a copy if you're a nonprofit organization, or $1.22 if you work at a for-profit organization. There's a little bit of tax, but no mailing or shipping fees to it. And Allison also mentioned that if really the barrier is the payment for that we'd be happy through the ECHO program to send out more of those dementia roadmaps to you. Thank you for that, Allison. There's so many care partner education resources. A lot of them people access through their local area agency on aging. Some of our local area agencies on aging have, almost all of them have some dementia coaching, dementia specialists, which I know they have out in Kitsap County. Some of the dementia program is sort of contracted with the Alzheimer's Association in King and Snohomish County. But again, the main contact through the area agency on aging can get people connected with whatever resources they have in their area. They also have caregiving classes like Powerful for Caregiving. They can screen to see whether or not a family member might qualify for some actual respite care. So having a caregiver come out to their home based on level of stress. So it's a really important resource for our folks. And again, the Alzheimer's Association also can help with the screening for those programs. Sometimes they direct people to the local area agency on aging. Certainly they also offer a lot of support groups or connect with that support groups through there too. The Lewy Body Dementia Association and the Association for FTD, they also have a lot of good specific information on symptoms that are more common in those conditions. And I put in the handout that I gave you some of the resources that I have found particularly helpful. Within the Lewy Body Dementia Association, I really like a portion that they talk about for called their care briefs, which really talks about these are some of the symptoms that you might see in a loved one with Lewy Body Dementia. These are ways that you can prevent those symptoms from happening, and these are some medication interventions that you can do to help. For FTD, both for people with aphasia or other behavioral issues, the Association for FTD has both great information for care partners on how to manage some of those challenges, but also a whole series of newsletters called Care, Partners in Care, geared towards facility staff that I've often worked with families to kind of work with the staff there to kind of help improve the loved one of the care of their loved one in a facility. Both the Association for FTD and Cure PSP, they also have grants for respite. So for people who wanted to have some in-home care to help with the caregiver stress and burden, they both have grant programs that they offer through there. All right, so moving on to sort of this idea of engagement, sort of like trying to help people to have that quality of life, and also recognizing that people are individuals. You know, again, the usual places that agencies and the area agencies on aging, Alzheimer's Association, and Dementia Support Group are great places if your patients and families are interested in finding those types of things in the community. Certainly if patients like to have their own sort of agenda of things that they like to do, sort of encouraging what's working for them. Within the Puget Sound area, there's a great resource called Dementia, dementiaseattle.org is the website. And they have local programs that are happening in person. They also have quite a few of virtual programming that could be accessed in other places. So some updates since the last time we spoke, more in the midst of the pandemic. You know, it's been so great to see some of these programs coming back in. I saw that the Look Again program on Bay Bridge Island at the Bay Bridge Art Museum has restarted. In Olympia, the Music Men's Minds program has started. Pierce County Music and Memories has started. So we're finally starting to see those activities where people can actually get out and connect with people. Because as helpful as Zoom has been, it's not the same as being in person. So to be able to offer some of these options is great. Another resource that's new is the Memory Hub that we've talked about some. This is a collaboration with the UW Memory and Fry Wellness Center, the Fry Art Museum. It's physically located at the Fry Art Museum. Also, on-site collaborators are the Alzheimer's Association, Full Life, and Elderwise. And we're really excited. This is a program which has been a long time coming. We put a lot of resources into this. A number of the programs through the Memory Hub are offered virtually. Support groups, caregiver workshops, creative engagement are offered virtually, so could be accessed from other places. They do have the Elderwise adult program has actually restarted in person on a mini day, so they're doing about 2 hours for now, hoping to increase to 4 hours in the coming months. Alzheimer's Association has a memory navigator there. This is also the physical space where ECHO is going to be based out of. And there are other opportunities for networking, professional development, and more. So hope that people will look at the website. I've got the link on my handout. I've been talking a little bit about education, dementia education, other language in language already. I did want to call out that Dementia Australia has really committed themselves to providing materials for the residents of Australia. And I think that in particular, some of their caregiver handout materials are good. I want to just give you the list of the languages that they have. It's really impressive. And, you know, some of these materials are really hard to find otherwise, you know, especially when people come to us, you know, they have large families at home that maybe don't have that same access to the appointments. So being able to bring them home with, or kind of share with them, you know, these are some communication tips. These are how you manage some challenging behaviors, can really be helpful. You know, they've got Ukrainian, Tagalog, you can see the whole list of places. Unfortunately, they still don't have Somali, which is something that, again, is really lacking in terms of resources for the community. But one day they will, or we'll find other resources for that. All right, so I know that was really a whirlwind. I will make sure that that handout is available and uploaded. I'm wanting to know if anybody has any questions or is sort of thinking about resources that have been particularly helpful for patients and families that they've worked with that they wanted to share.
Thank you so much, Karen. That was such a wonderful talk. And starting with really how to live well for the person who's living with dementia, and then kind of expanding to care partner resources and really practical information and education and support. So please, yes, let's open it up to our community. And if anybody has a concise handout that they use for somebody with a new diagnosis, or if there are questions, please unmute yourself and feel free to share, or if you want to put it in the chat. I see a question from Emma. Any PSP information anyone knows of in Vietnamese? And I think it does point towards this challenge of getting good information in many languages. So thanks for sharing that Australia site.
Hi, I'm Marielle. I'm one of the nurse practitioners with Palliative Care Outreach. Thank you so much for that, because I am brand new to the area. And so having more resources to go to is super helpful. I will say I personally love the Dementia Roadmap because it's concise enough that I can review it during my visits. And I find so often that patients have gone down the internet wormhole and their families just don't even know where to begin, because there's 7 stages, there's 13 stages, you know, there's how do we know where we're at? How do you know where we're going? So it's really, really helpful to have that on hand when I go for visits. So I'm glad that that's a resource I have to use, because that's been kind of key for me for those visits, not only to help educate myself as they're asking me questions, but to be able to leave that with them to use with the resources in the back as well. So thanks for sharing all of that. I appreciate it.
Yeah, you're welcome. Yeah, I agree with the Dementia Roadmap. I feel like it's a nice way to sort of ground meetings with families that I'm working with. Brock mentioned the Learning to Speak Alzheimer's book that's out there. I think that I saw you speak about that at some other time, and actually had a handout that you created, which I use here at the center as well too. I feel like it's a great handout. It's sort of like, you know, when your loved one does this, these are some strategies that you can say, and really goes through different scenarios. Yeah, thank you for sharing that. I also really like that. We didn't talk about the number of resources that are out there that I feel like resonate with a lot of families. And I love using that sort of like people learn in different ways. I will say that a lot of people really respond or feel like the videos where people are acting out how to, sort of like this is a common way that it's happening, and then replaying it in a way that goes a little bit better. The UCLA folks have a series of those videos that are good. They're included on my handout. Certainly Tipa Snow has so many great resources that just really spell it out. Like, this is why your loved one is having these things, to really humanize the person, bring that dignity. Like, this isn't a person who is a combative person. This is a person who is trying to communicate and really kind of walking through ways to support them in the midst of those exact challenges, even to like, I love that she's, very specific about brushing your teeth together, things like that. I did put the link to her main website on the handout as well. And the other great resources that people have found that we haven't talked about. Well, I will include the handout to be uploaded for this session, but you're all welcome to reach out to me if you have more questions. I've got my contact information on there too, and happy to problem solve or consult.
Thank you so much.
Thank you.
Karen. All right, and thank you, Kimberly and Sundance, for presenting the case. And I'm actually going to stop sharing now. And Randy, if you could please take over.
You want me to bring
Or
those
Allison?
slides up?
Yes, bringing up the slides that are regular deck. Or Randy, if you'd like, I can do that.
Okay, I'm sorry. I closed them down, but let me bring
Oh,
them
no, I got
back
it.
up.
Why don't I just go ahead and grab them?
Okay, I apologize for that.
Oh, no problem at all. Okay, so let me go, let me come back to here. Let me say that I'm going to share my screen. Let me go to here and share, and let's see if I go to here. Do you see the slides? Oh,
Yes.
no. Or did it do something funky?
We see the speaker view, not
Hey,
just the
click on-
slide.
Yeah,
Click on
that is a problem. Oh, wait, let's try this.
There you
How's
go.
that?
There you go. Perfect.
Got it? Okay.
Mhm.
Woo. Okay,
Just
so let
got
me
them
bring
up
this up to
too.
where we are.
Okay,
Great.
And here we are.
Thank you.
All right, so I'm Sundance Rogers, and I'm an internal medicine provider at Virginia Mason on Bainbridge Island. Can everybody hear me okay? Thumbs up? Okay, good. My practice is general internal medicine, but I focus on geriatrics and a lot of dementia care because Kimberly and I have been going to the assisted living facilities on the island and doing outreach into the community for many years now. And that's where most of our dementia care happens. And the interesting questions come up. And this is a little bit off the cuff presentation, so it's fairly short, but it has a fairly specific question for the group. We're going to talk about Ed the Good. That's what who he's known as. So a 95-year-old gentleman who was in the Swedish practice here on the island, and Swedish closed down rather precipitously, and he was transferred to our care. At the time he joined the practice in July of 21, he came with a diagnosis of Lewy body dementia that had apparently been made by his primary care provider in May of 2019. He was living at the assisted living portion of the dementia care facility on the island with the history that he had graduated from dementia care, where he had initially been admitted when he was diagnosed in 2019. He was we were told he had no disruptive behavior. He was a lovely person. He did have a bit of a hoarding habit, tended to have too many things in his room and wouldn't clean out his fridge. But other than that, with poor attention to his own personal hygiene, he was a model patient. We've been taking care of him since July and have noticed that he's had no decline of any sort in either cognition or behavior, which I thought was curious, kind of given his diagnosis. His past medical history is significant for atrial fib, heart block, and has a pacemaker. He's on an anticoagulant, BPH, and he's quite hearing impaired. And he does have some significant vision deficits. There's a note that he has a major depressive disorder that's associated with the Lewy body dementia, and that he never had a prior diagnosis. And he was on Wellbutrin for this, but not when I picked him up. His only meds now are donepezil, the Xarelto, and pantoprazole. And I had a little bit of lab work, which is the crit and the creatinine that you see there. I thought the interesting negatives when I reviewed through his chart and took the history from his wife is that he's never had any sort of a REM sleep disturbance. He doesn't have sleep apnea. She said no visual or auditory hallucinations. I could find nothing for Parkinson's. He's never had any blood pressure issues. I could find a note from probably 16 that said he was proud that he wasn't on any prescription meds. And understand that we did request the records from Swedish and we didn't ever get anything. So I'm piecing it together from ER notes. On his exam, we did a MOCA just in March and it was 18 out of 30. He was very engaging. He could easily fool us on a MOCA because he would answer questions like, what day of the week is it? And he would read the room. So if you started to look like you were going to agree with him, then he would go with his answer of Monday. And if we looked like we didn't have a happy face on, he would change his answer. Let's see. So the prior workup that we found was one imaging test that his wife dug out of her files and said, well, this is why he has Lewy body dementia. So it was a PET scan that had been ordered by his PCP in May of 19 for, as I put here, rapid onset dementia and anterograde amnesia. Findings are most suggestive of dementia with Lewy bodies, considered moderately to markedly advanced by his PET scan. And then I put in the slide I didn't make these slides, but anyway, preservation of the posterior cingulate and presence of the occipital deficits heavily favor dementia with Lewy bodies over Alzheimer. I also noticed that there was an order for a sleep-deprived EEG, but there were no results, and his wife doesn't remember if it was ever done. So based on that imaging, he was then admitted to the dementia facility on Bainbridge, where he eventually graduated from. So from everything I can gather, the only thing that says he has Lewy body dementia is that one imaging study. I can't find anything in its history that would make me think he has it. His course has not been consistent with it. And I would like to be able to say that he perhaps in fact doesn't have it. So that's kind of the question to the group is, how much weight do we put on an imaging study like this that seems to be so sure that that's what he has? Thank you. What questions do people have?
You mentioned depression. What symptoms of depression does he exhibit?
He does not exhibit any symptoms of depression that I can see. And his wife is not the best historian. So I got the impression that they were having a lot of psychosocial issues together, which is what resulted in some of the evaluation, and his hoarding had gotten to the degree that she couldn't manage it anymore. That was some of the behavioral stuff. But I didn't ever hear anything about specific depression. It wasn't on the antidepressant now that we've known him, and the staff don't report anything that would suggest depression.
Yes, very interesting case. And I have the same question as you, whether we can really say that he's got Lewy body dementia. That's a good question.
Mm-hmm.
Thank you, Julie. I'm curious what other folks think about this question of Lewy body dementia. Anybody else have thoughts?
I guess this is Franja, sorry. From the perspective of the family wife, I don't know who else is involved. Are they tied to this Lewy body dementia diagnosis in any way? Did it, enable something to happen, or does it represent something significant for them?
That's a good question. I would say they're not tied to it, and his wife didn't really have much of an understanding of it. And when I presented to her, kind of my thought process of why I really didn't think he had it, she thought that was very interesting, and she was totally willing to accept that. But I didn't ever think about it from that perspective, because in the few notes that she has here, it's the PET scan, and then there's a single page letter from the PCP telling an insurance company that he has dementia and needs to be in this facility. So maybe they needed the diagnosis.
Mm.
Yeah, it's a great question, and what an interesting specific imaging finding to of all the things to come across in the record. And yeah, I think we think about you have to be cautious about not interpreting a result in the context in the clinical context, and it's I guess looking at the reason for the imaging, it is sort of sudden onset. I think at this point, I don't know if we'd ever be able to find out why was that PET scan ordered. Was there a major fluctuation that happened? I don't know if there are fluctuations now that we could say, well, maybe that would help us think more about Lewy body disease. In terms of sort of treatment and management, obviously, when considering Lewy body disease, would we want to really avoid Haldol and caution the family about that? So I guess that would be one consideration of how much in terms of counseling about that specific diagnosis to take into account.
Yeah, it's interesting. I have not seen any fluctuation in behavior, and he really doesn't have any behaviors, which is great. We haven't had to medicate anything. He's just, obviously he's got some form of memory loss, but the other pieces are eccentricities that he has had throughout his life. And his wife wrote a memoir that she gave us a copy of. So we have a little background because we've been able to read that, and he ended up being quite the prominent player in the later chapters. And so I have vivid knowledge of his very eccentric behaviors, but things that wouldn't make me think of Lewy body per se. So anyway, I just felt like I wanted to get rid of that label on this gentleman if it's not accurate. There may come a point when he has some behaviors that we need to treat, and I would be more willing to try medications without that diagnosis. But I guess I was wondering from the expert neurologists in our midst, can you make a diagnosis of Lewy body dementia with an imaging test in isolation, or it needs to meet certain criteria with the history and the behavior in conjunction with the imaging, right?
Yes, definitely. And the Lewy body diagnostic criteria are sort of, I feel like, some of the most updated in terms of working biomarkers into the diagnosis. And they continue to make that point of, in isolation, a biomarker finding does not make a diagnosis, especially when we're thinking about does somebody have dementia or not. You always have to have the clinical correlation. I wonder, though, if as we get more and more sensitive and specific biomarkers, we will have the opportunity, if that's a good word, to discover findings. Wow, there's some alpha-synuclein. This person is at risk for developing dementia. There's substrate there. to develop dementia due to Lewy bodies, for example, but they may not currently have the syndrome. And again, going forward, I wonder though if keeping that in mind may tip you one way or another in terms of symptomatic treatment right now. So again, thinking about avoiding Haldol possibly. Also thinking about that, using the sensitivity to medications in a good way. Like, did he, despite that heart block, he does have a pacemaker in place. So a cholinesterase inhibitor, sometimes people with Lewy body can have that cognitive bump with a cholinesterase inhibitor. And so, that could also tip your clinical reasoning a bit too, if we continue to entertain the possibility of Lewy body being at play. I think it's also nice to think about that there are some benign courses of Lewy body disease. Again, I think it's unclear whether this guy has Lewy body disease, but it sometimes can be quite a scary diagnosis. I think people go online, they read about it, like it can be very frightening. And then there are some people that just kind of coast along. And wow, this guy made it to 95. He's got so many other factors in working to his benefit. And so just sort of putting that in the context you are doing.
The other thing that it made me wonder about and think that as a group, our Echo Dementia Project, and trying to educate the community about dementia and community providers as well, because I thought it was a curious workup for a primary care provider to do a sleep-deprived EEG and a PET scan, neither of which are studies that I would order as a primary care provider. I would be referring someone on to neurology, and I could find no neurology consultation. And I would think his wife, although she's not a great historian, I think she would remember that, and she doesn't remember there being a neurologist involved. So anyway, just kind of spreading our knowledge.
Yes, I agree. Thinking very specifically about why a test, what can be discovered when a test is ordered is important.
Sundance, this is Mimi. Thank you very much. This case is just so much fun to hear about. And I just really commend you for really digging into this and going through all the records that you've done, trying to get a handle on this. And I was very interested, how do you graduate from memory care? And is he now in assisted living, and is he with his wife? You said there were probably some conflicts in the past. And so that's one thing. And then you mentioned I'm wondering if she's his surrogate decision maker and kind of what planning has been done going forward. Every case that I've heard about this week has just kind of been a disaster, and it's just so delightful to hear about somebody that is stable and things are going well right now, and think about what a prime opportunity to make sure he stays on track. And it sounds like he's just getting excellent care from you folks right now. So.
Well, thank you, Mimi. It's interesting dynamics and how they've learned. I mean, they've been together for more than 50 years, and they discovered if they live apart, then they get along much better. And so they're both in assisted living. He's in one place on one part of the island, and she's in a place on another part of the island. And they had two separate houses before they had two separate assisted living facilities. So that has worked well for them. So she is his surrogate decision maker. They have a couple children who are also active in their care, and everybody seems to get along just fine. So that's worked out well. And yeah, I'm not sure how he graduated exactly, except that the memory care floors are definitely higher level of care. And the assisted living, he now has his own, closed door apartment and his own refrigerator, and can be his eccentric self down there, and he seems to be thriving. So it's pretty funny.
Thank you. That's great.
Sundance, hi, this is Nancy. I'm sorry, I'm in transit at the moment, but great presentation. Thank you for bringing this forward. And, I think to just emphasize that, as you pointed out, really questioning the clinical presentation at his age, 95, single greatest risk factor for Alzheimer's. He has vascular risk factors as well. He certainly is not presenting clinically, as you say, no fluctuations, no visual hallucinations, no Parkinsonism. And he's doing quite well behaviorally. So this is not a typical presentation. And I agree, making sure nonetheless to avoid any antipsychotics, which could be harmful if he does have some form fruste, I suppose, of Lewy body. Any questions from the community about this case? Any other comments or?
This is Allison. I just have a quick question, Sundance. Curious, if you were to, by magic or otherwise, be able to determine, oh my gosh, he doesn't have Lewy body dementia, how would that change his care at all?
I don't think it would right now. I would just take that name off his chart because that's a difficult dementia to have, and it has a lot of connotations with it as a provider. Yeah, I would just take the diagnosis off of his chart. And then if we were to develop behavioral issues at some point, I would be a little less worried about trying, although clearly Haldol is not something I use very often for behavioral issues in patients. But so if he was to develop a mood disorder or something, I would feel more confident about trying medication for that. But no, it's more of an academic question at this point. On an unrelated point, this dementia legal planning toolkit is great. We really have liked this tool a lot, and we're going to be ordering more because most of the providers here would like to use it. So thank you for letting us know about that.
Yeah, great.
I'm curious if you could share with the community what's been going really well for him. It sounds like he's in a pretty unusual setup, and it sounds like he's thriving given his challenges. He's living well with his dementia. So what have you observed, and what can you share that's working well?
He's kind of hunkered down in his little room down there. He likes to have his space. His wife and the staff are very respectful of his eccentricities. So if he wants to have 15 pairs of fur-lined gloves in different colors, that's okay. They are very respectful about how they deal with the refrigerator, which is apparently the biggest issue. And they do that quietly after he's asleep at night. And then he doesn't generally remember that he had whatever molded food is that he would like to have in there. So that seems to work out okay. He seems perfectly content that his wife is in the other assisted living facility, and she's very independent. She drives still, so she drives up to see him and has her little time with him. And the staff there have just gotten to know him and really enjoy time with him. So nothing too crazy about it, but he doesn't seem to participate much in the activities with the other residents. He has his newspapers, and he's ensconced in his electric chair that he can lean back in, and he's happy.
Thank you.
Nancy, I see that you're muted and you may well be in transit. So we had chatted before everybody joined us today about the fact that Nancy would be traveling and might not be able to continue facilitating. So we have a little bit of time left. It seems like we've kind of wrapped up this conversation. Unless Kimberly and Sundance, is there anything else you would like to ask? Okay.
No, we're all good. Thank you so much.
Okay. Yeah, you bet. So we wanted to then just put out to the community whether or not there's anybody who came today with anything that is sort of nagging, an issue that they are trying to resolve, a patient that they're working with, that you might have a specific question that you would like to bring forth to the group, just sort of in real time.
Oh, I actually have 5 more minutes on my meeting. So let's hold off on zombie for 5 minutes.
All right. Okay, then if people don't have additional questions, I am going to say thank you to everybody for coming here today. We will give ourselves the gift of time and break a little bit early. So we're really excited that next week we have our awesome Mimi Pattison chatting with us about palliative care. Mimi, anything you'd like to tell us now about what to expect next time?
Not really, but if there's anything in specifically that people would like me to address, please let me know.
Okay, cool.
That, yeah.
And you could either type something in chat, or if something pops up later for you, feel free to email me and I will pass it on to Mimi if there's something specific that you would like her to address. I did just in the chat pop in the link to our survey. I have also emailed it to everybody, and thank you so much for those of you who take a minute at the end of sessions to complete those. They really do help us. So we will go ahead and wish everybody well. Hope everybody stays healthy, and we will see you next time. Okay. All right. Does anybody have anything they want to pop in with, or shall we call it good? Karen, thank you so much. That was great.